Hello, everyone, and welcome to our July webinar. So, today we really want to talk to you about inflammation. So, as you see it there, inflammation nation, right? What they think is a silent epidemic of the modern human race. So, we actually have two types of inflammation in our body, and the first one most people are pretty familiar with. And if you sprain your ankle or you cut your finger, it's going to swell up. And that chemical reaction in our body that is called inflammation is a really, really appropriate in that injury. Now, there's also a second type of inflammation. So it's an insidious chronic inflammation of the cell itself. And that's really what we're going to be talking about today is the second type of inflammation, the inflammation that they're now looking at being one of the major contributors to modern disease. Also, things like the increase in cancer we're seeing in our communities, some of humankind's top killers, right? And also heart disease, and the intricate link between inflammation and these chronic diseases is really rooted in our evolutionary history. So, in order to survive infections and famine and other dangers, we developed hyperactive immune systems and insulin resistant bodies that were really, really good at storing fat. And our modern environment has been really, really transformed from the food we eat to the air that we breathe, how we move, and more, right? So our immune system is exceptionally sensitive to the triggers of this new world. And we are seeing a higher risk of this chronic hidden inflammation. And inflammation is intimately tied to essential life-sustaining processes that occur throughout our body. Metabolic processes, for example, so how we convert food into energy and reduce waste. Metabolic syndrome, it is a group of risk factors associated with heart disease, diabetes, and cancers, fat around the stomach, high blood pressure, high blood sugar, unhealthy cholesterol levels. And traditionally, these metabolic processes and immune reactions weren't viewed as distinct entities with different functions, but we now know that they are intimately interdependent, so you can't have one without the other. So managing energy and defending the body against infections is crucial for our survival. And fat cells, which are known to play a massive part in metabolism, and immune cells are actually derived from the same thing. They share the same roles. And when we see like this person here, that excess of fatty tissue, particularly the visceral fat that wraps around the abdominal organs, it actually produces a slew of inflammatory molecules. And in fact, in markedly obese individuals, more than half of the cells making up their fat tissue are actually immune cells. So we see this low level inflammation, and we see these ties between obesity and a variety of chronic diseases, including heart disease and cancer. So let's delve into that more. So what is chronic low-grade inflammation? There's two types, the acute one, which is like spraining your ankle, and this insidious, painless one, which I've just been speaking about. So chronic inflammation attacks your tissues at a cellular level, and heart disease is an inflammatory issue. And we call this, CLG, inflammation for short. And it results from those specific lifestyle choices. And these high risk behaviors, they're really well understood and recognized by science. And we can absolutely change these behaviors. So what does this look like, right? This low level, this low grade inflammation, it looks like heart disease, high cholesterol. And right, cholesterol is just along for the ride, right? We really, really make high cholesterol, especially to be out this really, really bad thing. We have to control our cholesterol. But cholesterol is it's just a victim of all of this. So cholesterol goes up because inflammation goes up, because cholesterol is how your body heals itself on the inside. So if your heart rate gets really high and your blood pressure gets really high, it damages the internal structures of those arteries in your body. And cholesterol needs to come along and try and plug up those holes for you, because it's trying to heal. Think of it like, it's a bit gross, but think of it like your body's internal pus. Pus carries something called macrophages, which is a white blood cell that helps you heal. So cholesterol just comes along for the ride. It's helping healing you on the inside. High blood pressure, increased risk of strokes, mood disorders, depression, anxiety, again, inflammatory reactions within the brain and the body, brain degeneration, Alzheimer's, senility. So we're looking at obesity, diabetes, cancer, joint pain, swelling, arthritis, atopic disorders, allergies, uh, asthma, eczema, acne, poor recovery, poor healing, and poor immune responses, right? So I'm sure we can all think of people who have maybe one, two, even all of these going on together, right? Really, really unwell and sick people. And so I want to talk to you about what causes silent inflammation, because a major, major cause is our diet. Okay, now if people haven't heard of omegas before, omegas are what we see in things like fish, they're fatty acids. And they're really, really important for controlling our inflammatory response. Now, we actually have two types. We have omega 6 and omega 3. So, a few people know of omega 3. Omega 3 fatty acids are what you get out of fishes and nuts. Really, really healthy for you, except a lot of people just don't eat enough of it. Now, omega 6 are your really, really saturated fatty acids. So these are the things we get from really bad diet choices. So McDonald's, from our really processed foods and snacks and treats. Basically, think anything that's kind of in a packet or fast food, that's going to have high levels of omega 6s, sorry. And if we don't get these balanced in our body, we see skyrocketing levels of inflammation, or if it's high for really long periods of time. So the ideal balance of omega 6 to omega 3 is 1-to-1. And now we are seeing 10-to-1 or 20-to-1. So that's crazy, right? We're seeing 20 times the amount of omega 6 in our diet and in our body than what we should be, because we eat such a processed diet and we eat what's easy, to be honest with you. Remember, fast food has chemicals in it that make you want to eat more of it. So we're seeing this major increase in omega 6 intake. We're seeing a major increase in inflammation through our diet, and major decreases in omega 3. We're not taking nearly enough to be able to balance out our bad diet choices. So I want to talk to you a bit more about omega 3 fatty acids and the cell membranes, right? Because we are all made of cells. We are all tissues that are made of cells, and cells are made of fat. Your brain is made of fat. Your nervous system's made of fat. And fat and sugar had a big war in the 70s, right? And who won? Sugar, right? Because it has a bliss point, okay? And fat was demonized, but our entire body is made of fat. And so cells have, I guess, windows and doors to let things in and out. And they also have locks and keys. So lots of different things can open lots of different locks. So omega 3s are what help your body allow things to pass through these doors and windows in your cells. So when we have a really, really unbalanced ratio of omega 6 to omega 3, that process no longer works properly. And so what we see is inflammation in the cell go up, because we're not getting those appropriate nutrients in. And we start to see unwanted fat and obesity. We see hormonal storms, because these fat cells are actually what allow your body to produce hormones. This is so incredibly important. And now we're looking at, unfortunately, research just coming out about how using anti-inflammatories, especially in men, actually increase your level of estrogen. So we're seeing testosterone actually plummet with men who are using anti-inflammatory drugs because of how inflamed our bodies are. Even things like human testicular physiology starting to change because of overuses of ibuprofen, because our bodies are so inflamed. Same thing in women, right? Just the opposite. We're seeing more testosterone in women. And when we're looking at things like cardiovascular health, we're seeing more and more the ties between heart attacks and heart disease and our diet and lifestyle factors. So our heart health is being, as a society, decreased. We had just a heart hospital open up in Monash to help and deal with how overloaded our hospitals are with people with heart problems. And it was fully booked within 2 days of opening, right? So it's a massive epidemic that we're seeing. We're seeing our blood vessels break apart because of fracture because of the increased high blood pressure. We're seeing high cholesterol because, as I said, cholesterol is going to heal those areas, but we're not addressing the actual cause. Most of us are just taking some medications to decrease our blood pressure or decrease our cholesterol, but it's not actually fixing the problem. Why is the blood pressure high? Why are we seeing people changing the way that they're supposed to move and eat and function? And it's because of our modern lifestyle, right? So we see increased plaques, increased clots, and increased strokes because of this. Joint health as well. So, of course, everybody knows if you've got inflamed joints and that inflammation's there for long enough, that's actually what causes arthritis and joint degeneration. So, disc joint degeneration as well. Joint pain, swelling, this affects your performance, it affects your recovery. If you're not healing, then you're going to be more swollen for longer periods of time. When we look at our brain health, so they're now looking, obviously, one of the most famous inflammatory diseases is diabetes type 2. Now we're looking at something called diabetes type 3, and most people know this as Alzheimer's, right? So diabetes is when your body is unable to deal with excess sugar. Well, now we're seeing the brain not be able to deal with excess sugar, and that is now called Alzheimer's. So it affects the way the brain is able to communicate to itself. It can affect pediatric development, can affect breastfeeding, your moods, depression, anxiety causes because as inflammation goes up, all of these things start to increase as well. And so when we talk about symptoms, everyone here in this room falls on this health continuum, right? So everyone's moving in a certain direction. And which direction are you moving in? I would love to know, because we're all moving at different speeds. And our first job is to stop that negative momentum and get all of you to move in the right direction. So I want to teach you how to interpret these body signals, how to look at the food on your plate or listen to your body and what it's saying to you, so that we can improve, and you can improve the way that you think about your body and about your health. Because there are 3 reasons we're in a health crisis, guys, okay? Number 1 is that we don't know what our body's saying. Number 2, people are taught that symptoms are the best indicator of health. And that's when I want to bring you back to this, right? So what causes silent inflammation? Imbalances in our diet. And I want to ask you, do you think that these drugs work? Do you think high cholesterol drugs work, high blood pressure drugs work to actually reduce your susceptibility to things ending your time here on earth earlier than what they should? So remember, headaches are not a problem, they're a symptom of the problem, and drugs don't correct the problem, they mask the symptoms of the problem. So you still have the problem, and the problem gets worse over time until the drugs don't work. And then the stronger, the more dangerous the drugs, then the more damaging the side effects, and now we have new problems, right? So I want to give you guys a really, really in-depth list of where we can get these omega-3 fatty acids from. So, because they are so, so, so essential, right? And you'll see there on that right-hand side, most of these things, right? You either kill them or they come out of the ground, right? Or they're animal products, or they're products that are natural. And so when you look at the other side there, the omega 6s that we all ingest, if we don't know about this, in very very high amounts. So those grain-fed animal proteins, corn grains, vegetable oils, right? What do we think Macca's chips are cooked in? Vegetable oils. And so most people think, okay, well, there's nothing that we can do, right? This is just our society. I have no control over this, but that's absolutely not the case. So you can do something to fix this, right? So reducing fast white carbohydrates, your breads, grains, cereals, and sugar, reducing omega-6 vegetable oil intake, add in those grass-fed meats and wild fish, game, and range-fed eggs. Increase those colorful fruits and vegetables, so increasing your antioxidants that are anti-inflammatory, and add in that supplementation and bump up your omega-3 so that we can bring down your ratio, bring down your inflammation. So reducing those carbs, reducing omega-6 vegetable oil intake, reducing and increasing those grass-fed meats, fish, eggs, and all those amazing fruits and vegetables. Now, I want to talk to you guys about fish oil. Now, we sell an amazing one called Metagenics in our practices because of how important and essential they are for health. And not all fish oil is made equal, guys. So you must make sure that we're getting one with enough of something called EPH and enough of something called DHA. So these are certain acids that are within omega-3s, and they must be in a ratio of around 2:1 for that omega-3 to be consistent enough to actually have the effects that we want. And we want to see that EPA around that 700 milligrams of a dose, and that DHA around 500. So most of those fish oils that you buy from the supermarket, they are nowhere near the levels that you need to be taking to actually make a difference and actually start to supplement your body back to a normal range and function. So have a look. If you've got any fish oils at home, you may find that some of the ones that you have brought, you might need to take anywhere from 3 to 4, even I've seen up to 10 fish oil tablets to actually get a dose that's going to be able to help you. So if you have any questions about that, myself, Dr. Tom, Dr. Johnny, Dr. Elise, we're all available. So take a photo of the fish oil that you currently use. We can also recommend you one that we love, so that we can get you functioning the way that you should be functioning. So eat, move, and think, right? Let's set that factory reset button and also look at what's happening with your stress levels too, right? Because inflammation is the underlying cause of most of the things that we are seeing in our modern society, killing our people and killing human beings. And what's the underlying cause of inflammation? Stress, right? So modern life is unnaturally stressful, and stress comes at us from every single angle: thoughts, toxins, and traumas. Okay, and these conditions cause subluxation. So it's a dangerous belief to think that your problems go away if you just ignore them. So we need to get checked, right? So the reason number 3 we've got a health crisis is that procrastination. So I would love all of you listening to this, if you can, get on to a very strong, very good quality omega-3 so we can decrease your chances of being one of these horrible, horrible statistics. Now, if you have any questions after this webinar, all of the doctors and staff are available to you, and we want all of you to take away from this to get on a really strong and healthy omega-3 supplement so that we can decrease your stress levels and increase your healing as well, guys. So I hope you have a wonderful rest of your night. Thank you so much for listening to our webinar, and I hope you all enjoyed it and took away something that can really help you and your families going forward. Have an awesome rest of your day.